I'm a big sports guy, so I like using sports analogies. Imagine you're the general manager of your favorite team, maybe the Seattle Seahawks, and you're in charge of putting together the best possible team you can. And so obviously you want players with different skill sets. You need a quarterback, you need receivers, you need big, strong offensive linemen. Same thing with our health team. No matter how good one individual is, they don't bring everything to the table. If you've seen me in the clinic, I encourage people to find out a good chiropractor, a good massage therapist, a good naturopath, a podiatrist. I mean, utilize everyone at your disposal. So having quality people on your team is a must. And have it established before you need it, which is even better. It all starts and stops with your primary care physician, your PCP. Oftentimes he or she is the gatekeeper. So make sure that you have a good physician that you see regularly, that's accessible, hopefully younger than us, so they're going to be around for a while, and also one that's willing to refer you out if you need it. And they'll be responsible for handling all your routine medical checkups and making sure that you're staying on track. The biggest thing is make sure they listen to you and that you feel comfortable talking to them about things that are uncomfortable. Urinary issues, maybe you've got some leakage, maybe you're having erectile dysfunction. I mean, those aren't fun things that you just want to sit around and talk to another dude about, but we do. We have to be able to talk about those things. So your PCP is like the captain of your team or the general manager, the quarterback, whatever analogy you want to make, but it all starts with them. Next is a good cardiologist, especially if you have any risk factors. Ideally, we're not waiting for us to have some sort of cardiac event and then have to go find a cardiologist. So what are some of the risk factors? If you are overweight, if you have heart disease in your family, if you are diabetic, these are all things, and we're over 50, talk to your PCP about referring you to a cardiologist to at least get established, get a baseline EKG, find out how well you're doing, but have a good cardiologist on your team before, heaven forbid, you might need one. And you need a doctor for your prostate, a urologist. They're going to help you if you are having some symptoms with your prostate. Get in there and establish yourself with a urologist. Then keep track of it. If there's any medications they can help you with. African Americans have a greater risk of both colon issues and prostate issues, and so for them it is critical that they establish a good healthcare team early on before they need it and start getting screening earlier just because of the genetic potential. Optometrist and ophthalmologist. So an optometrist is not a medical doctor. Those are going to be the ones that you go to kind of have your eyes checked, make sure you get your readers, contacts, glasses, things like that. Ophthalmologist is a medical doctor. Now let's say you're getting other visions, you're getting glaucoma, you're getting flashes, there's some other things going on. That's when you're going to want to see an ophthalmologist just to make sure that the bigger picture of your vision is still good. Macular degeneration, these are all things that you want to be under the care of an ophthalmologist. Now a dentist. Oftentimes our dental care gets kind of left by the wayside a little bit. But if you have any bleeding at all when you either brush or floss, and this is when you say, well, I don't even floss, haha. Well, no, you need to be flossing, okay? So go right now, hit pause, and go floss. And if there's any blood at all, okay, if you're spitting blood at all, you possibly could have some gum disease. The health of our gums is oftentimes a mirror into the rest of our overall health. So it's critical that we don't neglect our teeth. Dentists aren't just for cavities. And if you're bleeding, don't ignore it. Next on deck is your physical therapist. We should be first on that list, but okay, no, PCP should be first. But definitely physical therapists play a role in your overall health, right? Because we're the people that can hopefully keep you active, healthy, strong, give you guidance as to what you should do. If you're in the clinic, get our hands on you to help mobilize and get things moving. But basically the ultimate goal is to keep us as active as long as we can. Remember, movement is life, okay? So the stiller we are, the deader we are. So we've got to keep moving. And oftentimes your physical therapist is going to be the best person to help keep you motivated to move into exercise on a regular basis. And we'll wrap up the team with your massage therapist. Who doesn't love a nice massage? Whether or not you've got any pain or not, someone comes up and starts rubbing your shoulders, we just kind of melt. So having regular body work, even in the absence of any real major pain or dysfunction, is a good idea. I get regular massages as well too. If something's a little tight, it just feels good to have those muscles kind of kneaded and worked on a little bit. So make sure you got a massage therapist somewhere on your team. The next lesson, we're going to talk about when was the last time you had your physical exam, and also what are some of the things that you could be doing at home